upper cervical flexion. Everybody chin tuck. So sit up nice and tall. Shoulders back. I want you to keep your eyes level. I just want you to tuck the chin down. Okay? We're not trying to go here because you still need to see. You still need to keep your eyes level. So if you think about the counter rotation, you're pulling the chin down and lifting the back of your head up. Or I will oftentimes tell patients, pretend you have a string running through your spine and you're trying to lift the top of your head up. And by lifting the top of the head, typically that's going to tuck the chin down. You don't want to over-exaggerate it to the point that the person cannot swallow. Okay? You don't want them to feel like, oh, I cannot move, I cannot swallow. You just want to tuck that chin down so you're balancing out the head. Okay? So you would be kind of at that 90-degree starting goniometry range of motion. But you still want the patient to see. If they're tucked down too far and they have to lift their eyes up to see, that's not very functional. So it's just chin down.
In my arthritis class, we put our hand like this, and they just take their chin back away from everything.
Yep, you're going to have one just like that here in a few, let's see. Next week with posture. Yeah, we do a turtle. So to check to see if you're in a poor posture, put your hands up, and if you can pull your head back out of the hole, like a turtle, your head's too far forward. Oh, check. Yeah, arms forward. Arms too far forward. Yeah, we'll talk about that one next week. Yeah, there are all kinds of things for patients to make them remember. Okay. So you can also use the stabilizer. So this little doodad here we use for the lumbar spine. Oh, and also with the chin tuck, typically we're going to start that in a supine position to work on your chin tuck. So I'll have people remove their pillow, do some chin tucks in the morning before they even get up, do chin tucks at night when they go to bed, but also then through the day as well, working on the chin tuck sitting upright. But it's easier to perform and to hold when you're lying down supine because the rest of your body weight is supported. So I'm not having to pull my head back and find the right position. I'm lying down flat in supine and I'm already there. So if we were doing it with the stabilizer, this has got the full rectangular bladder that we put underneath the low back. In order to use it for the neck, you'll see it's got these little tabs so you can fold it over. Different people like to fold it different directions. One of our little tabs is broken off on this one, so it doesn't work. But you just snap it together. So once this is snapped together, now it fits underneath your neck. So it goes in the space in your neck. So if I'm lying down, just like we did with our pelvic floor, I can put this underneath my neck. I can pump it up to a certain point. Get it to stop. There we go. So I can pump it up and say, all right, I want you to chin tuck. When I chin tuck, that's going to press down against the bladder. So what's that going to do on my pressure gauge? Pressure is going to go up. Exactly. So if I'm not chin tucking and I have an excessive cervical, which lordosis or kyphosis at cervical? Lordosis, perfect. So if I have an excessive lordosis and my chin's out, that's going to have less pressure on this pin. When I chin tuck, now my pressure is going to go up. So you can have them work on, all right, try to get the pin to a certain level. Then you can have them progress up. I'll show you here in a minute as well. You can have them hold the chin tuck and do arm motions and things like that. But these are, again, a form of biofeedback where your patient can see, I am making a difference. I am moving my spine. I am changing the position. So not everybody has that body awareness. They can't necessarily sit and do this and realize that I've changed the position of my spine. So this is a good way to help them see that. Oh, okay, when I do this, I see the pin go up and I can feel that pressure underneath my neck. Oh, okay, I am making some sort of change. I am moving something. Okay, multi-directional isometrics. Isometrics, always a great basic exercise. So, get your patient in a nice sitting position. I like to do these in front of a mirror, if at all possible, so in case you can see that my head is upright, that I'm level, my eyes are on the horizon. So think about all of our motions. So everybody sit up nice and tall. fingers on your forehead and push directly back into your forehead and resist flexion. Okay? It's not as strong as our manual muscle test, but it's very gentle. Press. Okay? We can take a hand behind our head, resist, extension. Hold it a few seconds, release. We can take hand to the side of the head and resist lateral flexion. So you're trying to laterally flex, but your hand is stopping you. Okay, we can do it on the same side or opposite side. We can resist rotation. So same basic position, only now I'm trying to rotate, but my fingers are going to resist rotation. Okay, I'm going to resist rotation. So you can say just look with your eyes. Don't let yourself rotate. So very basic isometrics. And just a soft press, gentle hold, 5 seconds or so, just to engage muscles and then release muscles. Sometimes your muscles are so tense that they don't realize that they're on and you don't realize that they're on, and so just giving a little isometric push is enough to break it because it has to contract more, and then you think about releasing. I've contracted, now I think about releasing, and that will shut the muscle down. Isometrics are great. Posture correction against the wall. We talked about the lumbar spine as well, that we can put somebody up against a wall and flatten out their low back. Well, we can do the same thing with the cervical spine. Park somebody up against the wall. If I'm back against the wall, I'm going to do my chin tuck. My head should be back against the wall. Okay. That gives your patient that tactile feedback that I'm pushing back against the wall. If their head is normally 3 inches from upright, and they have to pull it back to feel the wall, oh wow, that's back there ways. I'm really off. If it's somebody who is kyphotic, so my elderly folks that are kyphotic, I will park a chair up against the wall and put a pillow between their head and the wall and have them just try to push back to the pillow. That gives them some extra padding for one, and it also gaps that space. If they're kyphotic, there's no way they're going to get their head back against the wall unless they really extend, and that's not the position that I want them to be in. I want them to pull back. More of a cervical retraction, just pulling straight back against that pillow. So all of these have some sort of a component of biofeedback. You need some sort of a tactile cue. Putting someone in front of a mirror gives them that visual cue. You touching them gives them a tactile cue. Postural muscles really need those constant tactile cues. We had a Undress the Stress program here, Wendy Simmons runs, and for all the employees there are different things that they do, and most of us who are at all into our jobs have a tendency to sit at our desks and work through lunch, or we get going and we get tunnel vision and hours will pass and we're still typing away on Moodle, we're still on email, and we don't break that cycle. We get up and move. And there was some great software when you signed up for this program. They sent you the software to go onto your computer, and every hour it rings, and this little person comes up and tells you it's time to stretch. And there are little programs you can choose. You can choose certain ones, or just has a basic program, or you can just set it so it just reminds you. And I'll have people with watches that will beep on the hour. I'll say, turn that on. Turn that function on every hour that beeps. You need to do your neck exercises to get yourself in a good position and check. So anything that you can do to help remind. I've threatened to come up with some sort of device that clips on you that's my voice that tells you something. But I hear from students that happens anyhow. So when they're out playing, they hear me talking to them all the time. But anything that's giving you reminders is really good for these cervical and postural muscles. The slow-mo ball, range of motion. So we don't have a slow-mo ball, that's just the name of one brand, but if you remember those balls when you were kids, that they'd have a big cage with a whole bunch of little kind of cheap plastic balls that might have Spider-Man or flowers or different colors. They were, a lot of them were tie-dye or swirly looking. Well, this one's just a little soft, squishy ball. It has little cilia on it. You don't need these, but just a ball that's partially deflated, a soft plastic ball. It can't be one of the hard, it can't be a basketball or a volleyball or anything, but something that's soft. You can have someone lie down on it, and this will be kind of like our half foam roll was for the ankle. So this cushions and cradles my head, but it will allow me smoother movement. I can work on my rotation, and I'm just rolling side to side on this ball. But at the same time, it's making me strengthen and work range of motion because I have to control it. If I didn't, I'd just fall off to the side. So I'm engaging my stabilizing cervical muscles to help control, and all the while this puts me in a chin tuck position, so I'm not really able to get out of that chin tuck position. So this is a nice, gentle way that someone can do some strengthening and stabilizing exercise. Just get one of those little cheap kids balls and inflate it part way. Some of the clinics I've worked at, they actually have ones in the clinic that will sell. Those were called slow-mo balls, and they were plastic, and they had this little straw that you could blow into to inflate them. And so just half inflated, cradles the head, assists your range of motion and your stabilization.